Good afternoon. My name's Dr. Christopher Mogan. I'd like to thank the Mental Health Foundation Australia for inviting me to present today. The topic is strategies for managing complex anxiety. We'll start off by just defining complex anxiety. Anxiety is a normal emotion. It becomes abnormal when it's triggered too easily, when it lasts too long, when it reaches really high intensity, and when it interferes with the person's functioning. We've come a long way in managing anxiety in terms of characteristics of anxiety, which might range from generalized anxiety disorder, which is worry, social anxiety disorder, which concerns a center of attention phenomena, like meeting new people, talking in front of a group. Post-traumatic stress disorder is a major contributor to mental health problems. And in every community, there's a large group of people who are suffering from post-traumatic stress disorder, whether it be war-related or violence-related, or related to adverse childhood experiences. So a person may have experienced childhood violence or abuse, or may have witnessed such experiences. One aspect of anxiety that I'm very familiar with is obsessive compulsive disorder. And it has a huge impact on the 1 or 2% of people and their families who suffer from OCD. So when we look at strategies to manage, there are other types of anxiety, by the way. Phobias is the most common form of anxiety, and in some ways is more easily treated. We have indeed many other comorbid states. In terms of strategies, the first strategy I want to mention is the most intense strategy, because we're talking about comorbid anxiety. So there's likely to be another condition also in the diagnostic picture. So a person might have anxiety and depression mixed, or might have a bipolar disorder, panic disorder. So it's not just a single diagnostic entity. Now what we would do is try to find out what the primary diagnosis is, and our assumption for today's work is that it's an anxiety disorder. So I want to just go straight to the point and say that we need help to overcome anxiety. It will not pass without treatment. And so the therapies that are available are generally across the mental health sphere, the biological type therapies, and then the talking therapies. I'll just give you a brief, I'm not sure of the audience we've got, but going back a slight journey in history, you can say that the conflict-based triggers are the basis of psychoanalytic treatment. So that conflict begins in the unconscious, and the therapist works very closely with an analyst, and the analyst is trying to uncover the conflicts within the unconscious. This is an intuitive type therapy, and it is the longest running therapy or its variants for treating anxiety. So the therapist goes into great detail, daily sessions, lengthy treatment, and is treating the unconscious material accessed by dreams or slips of the tongue. Now, opposed to that therapy over a long period of time have been behavioural therapies. Behaviourists would say there was no such thing as a mental state, and it was more scientific in terms of what's the antecedent, what's the behaviour, and what are the consequences. As time went on, it was clear that there were awareness, intention, there were indications of a mental state in terms of all of the symptoms that were being experienced, and these were dealt with in terms of cognition. What were the ideas, what were the feelings, and such was born cognitive behavioural therapy, which is an umbrella term for a vast list of therapies. Now, for the person seeking help, I suppose in some ways it's a referral by a doctor that knows them, and hopefully you will be sent to somebody who has expertise in CBT to assist in terms of anxiety. So the first thing the person is going to do is to make an assessment of the presenting features of the case. So what are the triggers and what are the thoughts associated with those triggers? What are the ways in which the person might seek to challenge the anxiety symptom? Just as an example, if a person is having thoughts that are out of character for them, they could be violent, intrusive, sexual type thoughts. Sometimes they will substitute another thought to try to neutralize the effect of that thought. And there's a vast array of anything that you can think of that a person might do in order to shift the focus away from the intrusive, unwanted, against their values thought that is really upsetting them and those close to them. We then look at the actual rituals in quite a lot of detail. And finally, we try to uncover the avoidances. What is a person doing after they've had a bad experience? They may say, I'll never go to that shop again because I've had a panic attack there. Or in fact, I'll never go shopping alone unless somebody accompanies me and is able to help me in the event of a panic attack. When we try to understand that process of what happens when a person is suddenly overwhelmed by a range of symptoms, it's like a completely destabilizing event. Now, sometimes that's a cumulative event, sometimes it's a sudden shock. But when a person has that, we can have that first slide up where we're seeing the destabilization that occurs when a sudden trauma is creating enormous stress for the person. And that destabilization then causes the person to swing from various stages of at the best they can be is almost normal. They're not normal, but they're managing, and the whole range of destabilization can go through to where there's a complete loss of control. So they're emotionally overwhelmed. Now, a person could be at any point in that pendulum swinging, but never right. So that emotionally overwhelmed state is the state where people will have reactions like flight or fight or freezing. They will be overwhelmed by a cascade of symptoms, which can range through from tightened throat, jelly legs, nausea, dizziness, such an overwhelming state that interventions are really necessary to stabilize them. Now, in the CBT model, the focus is on the thinking that a person does, the affect, and the behavior. So those three short steps are Am I thinking clearly? Or have I become neurotic in my thinking, completely overwhelmed in my thinking, completely unrealistic in my thinking? So a person is taught by the therapist to challenge thoughts, to try to see if they are overreacting or appraising those thoughts in an inappropriate way. Second thing is that associated with those thoughts is an affect reaction, so emotional turmoil. So a person might say, bad thought, I want to hurt someone. That bad thought means I have a bad mind, and that means I'm a bad person. So a stream of negative thoughts can lead to frightened affect, overwhelmed affect. And the third link to the chain is the behaviour. So behaviour is affected in the sense of avoidance or in the sense of safety behaviours or in rituals. So we call it a TAB link. It's how we think, how we feel, and what we do. Now, in each case with those interventions, we can target something in particular. So a person may indeed have a set of beliefs that we need to target. And we need to explain to them that we're going to help them sort these beliefs out. So the collaborative model is what's happening, give you some examples of what you've been doing, and outline some strategies and skills that we need for change. Now, one of the most obvious in terms of panic is rapid heartbeat, overwhelmed breathing, fear of fainting, and just being completely at that stage of emotional overwhelm. So we want to try to teach people that there is a breathing rate that they can feel very safe if they're breathing in this steady manner. And so one of the first things that we do in a session is we might ask the person to measure or count the number of breaths they take over a period of time. We're looking at, for normal range of around, the normal range could be anything from 8 to 18, depending on the person. But the most effective range is something around 10 or 12 breaths per minute. And we can help them to stabilize their breathing using mindfulness techniques, or just using slowing down of your breathing techniques. These are self-help, easily done, and people who are able to practice their breathing are able to slow down their mind and their body. Now, some people are critical of this method because they think there's a normal way in which the breath will righten. But my experience has been, if I take the breath of a person sitting before me and their breathing rate is in the 25, 26 breaths per minute, I want to help that person to bring their breathing down to that 10 to 12 range over a period of time, just simply by doing breathing techniques such as the first and second exercises in the mindfulness training, but simply in the many such breathing techniques that are available online. So moving through from that stabilized state where a person, if they're breathing at that level, they can be sure they won't panic. If you walk into a meeting breathing at 10 or 12 breaths a minute, the chances are that you are going to manage this meeting very effectively. Now, when we try to do such things as a target, like attending a meeting, we don't put that in place immediately. We go for a list of targets and we rate the anxiety that they feel in a 0 to 3 for a low range target, 4 to 7 for a medium range target, and 8 to 10 for the high targets. Now, what we want to do then is we say we're starting off to teach you exposure techniques at the very small level. First of all, explaining it very clearly, coaching them to do it, modeling the exposure, and then gradually going out with them to test it out. And as the person's skills develop, they find that there's no need for avoidance, there's no need for safety behaviours, there's no need for rituals. So they pass through from being approaching something where they felt not safe and learning that that will habituate to a very low reading of anxiety in that situation. Repeatedly practicing such a process can lead to a complete extinction of that fear. Now, many examples of that can be explained in terms of things like someone clenching their teeth, or somebody having teeth grinding, or having what we might call a tic. So we do a reverse habit training using very graded exposure in that manner I've described. When it comes to affect, so how I feel, we want to be able to be in touch with how we feel, but we don't want to be overwhelmed by feelings. Now, an Australian doctor who's recently been in some fame is Dr. Claire Weekes, and the book that was a biography written about her is called The Woman Who Cracked the Anxiety Code. Now, just a brief word on her work. She would believe that people become sensitized in the sense of they can't control what's happening in their life. And over a period of time, a person could be sensitized by a period of bullying at work, or might have a lifetime of sensitization, which causes them to be unable to field the negative thoughts that come, or manage upsurge of breathlessness or a surge of symptoms, because they're exhausted. The exhausted mind cannot easily dismiss that unwanted intrusive thought. So an intrusive thought might come about, I would harm a child if I was left alone with the child. Most people, well, everybody has such weird thoughts, contrary to their beliefs and contrary to their behaviour, and can be very upset by it, but they simply dismiss it. So the thought pops into their mind unwillingly, and it pops out again. But for the highly anxious person, such a thought, their mind is already exhausted. And so a person might, a mother might say, what if I drop my baby? The thought just comes into her mind, and she hasn't got, because she's exhausted, the capacity to let that thought go through to the keeper. Now, sensitization for Dr. Weekes was the first step in the mind becoming overwhelmed, bewildered, and suffering a huge amount of symptoms. But her belief was that calming the mind, slowing down the body, allowing time to pass, that the body is waiting to return to a normal function. Now, I've found on reading her, reading the biography, it also made me recall the many self-help books that she wrote and many tapes that she has that are available online. So I recommend Dr. Claire Weekes's work. I'd also like to refer to the modern, contemporary introduction of neuroscience into the treatment of anxiety. Now, the work of Dr. Ledoux, Professor Joseph Ledoux, has been very helpful in helping us to understand that every behaviour that we have is a circuit of its own. Now, when it comes to OCD or panic attacks, that circuitry is well in place when a person is symptomatic. What we want to do is we want to try to get new knowledge. We want to challenge the assumptions behind panic attacks. We want to look at the skills like slowing down your breathing, knowing that this surge of adrenaline will pass over time. What that knowledge is stored as memory. But if we don't continue to practice these behaviours, so one of the critical elements of CBT is learning new techniques, being coached in how to use these techniques, and practicing these techniques every day so that they pass from being a short-term memory. Through protein analysis, they become fixed as a long-term memory. And this long-term memory, through working with a therapist, enables them to systematically tackle those hard and fast habits that have been literally ruining their lives. This goes for right across the anxiety disorders. From panic disorder, avoidance, to a range of others that are destructive of family life and personal life. So the work of Dr. Ledoux is, the importance of it is that we can form new neural pathways which become powerful and repeated, and we can change our lives on that basis. So we first of all have to be taught the techniques. We have to be guided through therapy in the treatment and consolidate that learning. That learning has to be consolidated. Now, one of the points that happens is, what if the behaviour returns? So a relapse prevention plan needs to be put in place. In this relapse prevention plan, we know that roughly about 90% of relapse occurs when we have other letdowns, our mood drops. In the case of a complex anxiety, there may be a number of different symptoms being challenging the person. So when that relapse occurs, it's generally related to low mood, or it's related to conflict within the family. There may be stresses, like if we take the last 12 months, anxiety has skyrocketed as a result of a situation in which none of us have any control, and that is the COVID-19 circumstance. And what we do know, though, is from what we can control ourselves in managing the public health advice to wash, to keep clear of people, to practice safe distancing, and to make sure that we follow everything that is explained in terms of vaccination. And the third element of relapse is the issue of old habits returning. Now, again, this can be when we're, as Dr. Weeks calls it, when we're sensitized, where our mind loses its flexibility. And so a thought comes into our mind that we can't process. But if that person is taught to recognize that we have to face the things that we fear, we have to accept that this is part of how the world works, but we have to then have an attitude of pushing back, floating through, letting that anxiety go through to the keeper, as I've explained, and let time pass, because our powerful mind is there to keep us alive, to keep us aware of threat to us. And the human is the most remarkable creature on earth in the sense that we have consciousness. We have awareness of our future, some awareness of travel into the future, some awareness of things that have happened in our past, but our focus is on psychological flexibility in the present. So when we know what our high-risk situations are, we can prepare for them. When we know that there are strategies such as relaxation, such as watching our appraisal, being prepared to seek help, these things are the way in which we get more control. And the prayer of the alcoholic's prayer, I think, is a great way to think of this when we think of to change those things we can change, and having and accepting the things that we can't change. There's some things we can't change. We've got to just accept them, but we've got to be wise in terms of taking steps to get help. Now, I come back to the major strategy that I see as important in the management of anxiety, and that is seeking help. And that help is available on the end of the phone. It's available on a Zoom. It's available by going to see your doctor and get a referral to a mental health professional. And these are the people that can guide us and support us into a time when we are empowered to see anxiety as, to be aware of anxiety, to accept that there are times when we will feel overwhelmed. But if we see that anxiety as just a part of us and are able to step back and reset, we know about low-level anxiety, moderate-level anxiety, high-level anxiety. We've got to look after ourselves and be prepared to develop our skills and strategies in managing anxiety so that we don't just go into a situation where we'll be overwhelmed. But that idea of is a practice, and seeking help as necessary. We've got to expect that anxiety isn't going to be in our lives because it's part of our lives, but it's very possible to manage it completely.